You're welcome back to the Rise interview. We're live in Nigeria's capital, Abuja. My name is Christian Ogodo. A major fallout of the management of the coronavirus pandemic in Nigeria has been the obvious divergent positions by the federal and state governments. This is manifested in the issues of protocols for the lockdown, testing, the distribution of palliatives, and the movement of almajiris. Indeed, the handling of the pandemic appears to have been politicized. Also, globally, there's a big debate about the media and the COVID-19 conundrum. Did the media blow the COVID-19 out of proportion and then caused panic amongst the populace and the government? For more on this, let's turn now to Iyobosa Uwugiaren. He's the editor, Nation's Capital This Day newspaper. Thanks very much for joining us.
Good evening.
How would you assess the media's performance in the last 3 months or thereabouts when the COVID-19 virus hit the world?
Like you rightly know, the COVID-19 is a global issue, and the way the media report it has to do with the impact of the virus in many of the countries around the world. Initially, when the whole thing started in 2019, there was that deliberate attempt by the Chinese government, to hold information from the media, obtained some, foreign medias,
exposed
what was going on, and the WHO was forced to come out with a clear picture of what is happening. Yes, because of the impact of the pandemic, is natural that the media will for a very long time, focus on the issue.
They're feasting on it.
Yes, exactly, on the issues. For example, look at the US, the number of people who have died as a result of the COVID-19. In the whole of Africa, the whole thing is also, gradually, climbing up. The statistics, the figure. For example, Nigerians yesterday, Nigerians we tested almost about 24,000 plugs, and we have almost about incident of about 7,000 plus those who have tested positive for the COVID-19. So it's natural for the media to focus on the issue. And as I speak to you now, I think there is no issue around the world, that is more impactful, than the COVID-19.
But would you agree, to what some analysts are saying, that the media probably blew the whole pandemic virus out of control? Have they been sensational in their reporting?
For me, I think the reverse is the case. For us as a media in Nigeria, I don't think we have done enough, in trying to mobilize the citizens, trying to mobilize the public, trying to educate them about the impact of this virus and the need for them to be very careful and maintain all the necessary protocols. What we have done so far in Nigeria, as far as I'm concerned, is just announcing what the information the federal government is giving us on a daily basis. We have not really developed strategies, informations that will really, frightening the citizens, to be able to take necessary precautions in maintaining the necessary protocols as spelled out by the WHO and the NCDC. If you look at what is happening, and I blame those managing the informations of this COVID-19 on the part of the federal government, because what we are deeply involved in here is what I call risk communication. All we need to do is to see how we can, garner the support of everybody to be aware of this pandemic and the need for them to maintain or to respect the necessary protocol. If you look at the messages being developed by the federal government, it's purely entertainment. And that is why if you look at the way people respond to the issue today, they don't see it as a big deal.
Like a bicycle.
Yeah, they believe, oh, well, this thing is calm. and we need to move on with our life. They don't even believe. Majority of Nigerians do not even believe.
Maybe because of the way they distribute the palliatives and the rest. And how can you say you're feeding school children that are on lockdown? How?
I don't think that is the reason. I think the reason is that the
Is the media even interrogating all that enough?
We've done that. We've done that. I'm sure it is because of the way the media interrogated the issue that the Minister of Humanitarian Affairs was now forced to reverse her decision recently. That decision to feed school people who are at home, budgeting billions of naira for that scandalous initiative that was later jettisoned by the federal government. I think the media is responding to that, but what the media is not doing enough is, apart from reporting the information being given to us on a daily basis by the federal government, by the Ministry of Health and the Presidential Task Force, is to really interrogate what is really happening. Look at what the New York Times did about two days ago, where they published all the names of the victims of COVID-19. And in that report, you will discover that they had one or two things to say about each victim. That, for me, that was a huge effort on the part of the New York Times. But in Nigeria here, what we do is just to merely report what the federal government is telling us on a daily basis. And unfortunately, the people managing the information are not doing it very well.
Very well,
because risk communication is a process. When, by the time you are giving information, I discovered at the point you evaluate your impact of what you have done, and discover that there's a change of attitudes on the part of the people, you also need to change your messages, the channels to which you pass that message to the people. And unfortunately, the federal government is not doing that, and they don't have media expert that is helping them to do these things, and it's quite unfortunate.
Iyobosa, let me ask you, don't you find the issue of those Chinese medical experts who came to Nigeria unfortunate and, leaving one really wondrous when the health minister, Dr. Ehanire, said he shouldn't be asked any question again about their whereabouts? He went to receive them at the end. Why are we not interrogating that?
Yeah, but I think the whole thing is quite confusing. For example, when those medical doctors, so-called medical doctors, came to Nigeria, and I said, look, there was something wrong with that, because if you look at the way the Chinese government managed their own issue, I thought with Nigeria we need to gain
such experience
from them, and they're in a position to tell us or to share information with Nigerians on how they were able to manage their own crisis within a short period of time.
But that could be done virtually.
And they got a very good result. But you see, when they came, we were told that they came on the invitation of one construction company, a Chinese-based construction company that is based in Nigeria here. But of course,
the minister was at the airport to receive them private
and they were isolated. They were isolated for about 14 days. And after some time, the media asked questions: where are these doctors? And I was scandalized when the Minister of Health told a journalist about a few days ago, and that people should not ask him about the whereabouts of the Chinese doctors. But there was a statement by the Chinese embassies here about a few days ago, telling us that they are done with what they came for, and they would have been back to their country, but for the ban on international flight. But like I said, I'm not too sure.
Something is curious.
So I think the media need to really, find out what is missing and what the federal government or the Ministry of Health is not telling us.
Some people are already, carrying the notion that, they came to install the 5G network here in Nigeria.
No, I think such conspiracy theory is unnecessary. Nigeria, forget Nigeria is also a country. We are mindful of the well-being of our people. We are mindful of the security situations. I'm not speaking for the government, but I don't think there's no responsible and responsive government that will allow any country or any national to do something that would not that will affect the well-being of its citizens. I don't think so, and I want to believe that the government of the day is responsive and responsible enough to know that.
Yes, because there's not been any contract awarded, for the 5G installation. At least we would have known from the Ministry of Communications and Digital Economy, as well as the Nigerian Communications Commission, NCC.
Chris, let me say this.
Very quickly,
but let me say this. I think
from
what we have been able to find out, been able to examine, I think this G5
5G
5G has
network.
something to do with the
Coronavirus.
pandemic, ravaging the entire world.
All right.
Because we have so many countries today who are having this severe impact, but they don't have 5Gs in their countries.
Absolutely.
So there's no link whatsoever between the 5G and the COVID-19 pandemic.
All right. Thanks so very much. Iyobosa Uwugiaren is the editor, the nation's capital, of This Day newspaper.
Thank you very much for inviting me.
Well, that's it for this edition of the Rise interview. Do join us again tomorrow from me and the entire team here in Abuja. Goodbye and thanks for watching.